Hello sir, good afternoon. I am Rose Angie Baratigi and I am a nursing student from St. Scholastica's College of Tacloban. So, before we start sir, I have some questions for verification lang po. What is your name sir? Romar Vincent Narza. So, how about your birthday po? August 27, 2002. Okay po. Your age sir? 19 years old. Okay po. So for today, sir, I'm gonna explain to you the procedure that I'll be doing. So for today, sir, I'll be assessing your eyes and your visual acuity. So for me to be able to assess those things, I must perform some vision tests, some extraocular muscle functions, and some of the external eyes extractor. I'll be inspecting those and palpating your parts of your eye. Is it okay to you, sir? Okay po, sir. So, I'll rest assured po that all the documents and findings na inonote ko po dito sa ating assessment is completely confidential between me and the attending physician that I'll be referring you later. Is it okay to you, sir? Okay po. So, before we start, sir, I'll be asking some question po for current symptoms, sir. So, sir, do you feel any changes in vision po? Hindi naman po. Wait lang po, sir. I'll just put my... Yeah. How about spots and flutters in your eyes po? In front of your eyes? Wala naman po. Have you experienced trouble seeing at night po? Hindi po. Okay po. So, have you experienced double vision po? Hindi rin po. Okay po. How about eye pain po? O pagsakit ng mata niyo po? Hindi rin po. Okay po. So, do you experience redness or swelling in the eye po? Redness po? I see. Okay. Kailan po ito nangyari, sir? Yung pamumula ng mata niyo po? Last week. Okay. I'll just note it here, sir. So, how about po sa excessive watering or tearing of the eye po? Minsan din po. Okay po. So, sa past history naman po, did you have eye or vision problem po? Wala naman po. Okay po. How about po sa family history, sir? Does any in the family po had an eye or vision problem po? Wala rin po. Okay po. Sa lifestyle and health practices po, do you have any exposure in any chemical, smoke, or flying particles? Wala naman po. How about sa vision loss, affected ability to work or care for self-others po? Wala rin po. So, okay sir, before I start po with your assessment, I'll just sanitize first my hand, and I'm gonna put a gloves po. Is it okay, sir? Is it okay, sir? Okay po. So, wait lang po, sir, ha? So, now I'm gonna put my gloves first. Para po, dire-diretso na po tayo sa ating assessment. So, okay po, sir. So, before we start po, I'm gonna have privacy po. I will close the curtain for our privacy now po. Wait lang. So, I already provided that privacy for the patients, and I already performed the hand hygiene, and I also wear the gloves po. So, okay, sir, we're going to start with your assessment po. So, okay, sir, I'll be performing the vision test po. And yung una po natin gagawin is the distance visual acuity po. So, which is, meron po akong ipapabasa sa inyo na Snellen chart, and you have to read it from 20 feet away from the chart po. So, is it okay to you, sir? Okay po. Can you read it now, sir? The Snellen chart behind my back po. You start with the big letter po, the top. Okay po. Okay po. Okay, sir. Okay po. Okay po. Okay po. Just tell me na lang po, sir, kung hindi na po kaya ng mata nyo na makabasa po. The smallest letter po. The numbers po. Okay, sir. So, can I ask, sir, do you have an eyeglasses po? Gumagamit po ba kayo ng eyeglasses or protection sa mata po? Okay po. So, sir, can you read po the Snellen chart po from the very top po to the lower bottom po? Okay. You start now, sir. Next. Okay, sir. Okay, sir. So, let's cover po your eyes po. Then read it from the top po, ha? So, I'll be the one who hold that OP card po. Okay, sir. Read it from the top, sir. Okay, sir. Next.
Okay, sir. So, the other side of your eye naman po. Read it now, sir.
Okay, sir. So far po, as I observe po, when you're reading po the Snellen chart, medyo po, hindi na po kayo nakakabasa ng mga small letters po. Hanggang, 10. Medyo okay pa po. Pero may mga part po na nahihirapan na po kayo magbasa. So, the next, sir, I'll be going to perform the near visual acuity po. And we will going to use the Jigar chart po. And it should be 14 inches away from you po. So, since I don't have a Jigar chart, I will going to tell to my patient that we were going to use a Jigar chart. And it should be 14 inches away from her. So, from him. So, let your patient read the smallest part he or she can read. And after reading without an eyeglasses or with or without an eyeglasses, you let your patient read with an OP card. So the next, sir, I'll be assessing your visual fields. So in order for me to assess your visual fields, I will pointing my hands here, and if you saw it, you tell stop. And you will have to, we need to cover our eyes. Oh my.